Hello friends, welcome to my channel. I hope you all are happy and healthy. So in this video I'll be discussing about how to select a good hair transplant clinic. So in case you have decided to undergo hair transplant surgery and unsure about deciding which clinic you should go, or you have decided the clinic and almost about to finalize but are unsure that okay, this I should negotiate, this I should not, and if this clinic gonna be right for me. So I will be telling you how to negotiate properly, how to discuss, what to discuss, and what all parameters you should keep in mind while selecting a good hair transplant clinic in order to ensure the best result, the best surgery in a safest way possible. So point number one, so the doctor which you are selecting for your hair transplant surgery should be a MD doctor. Almost all of the points which I'll be discussing in this video regarding the selection of hair transplant clinic will be revolving around good clinic, good hair transplant technician and team, and good hair transplant surgeon. So you need to be very sure that you are going to a well reputed, experienced in hair transplant. Every plastic surgeon can do hair transplant surgery, but only a good and experienced hair transplant surgeon can give you the best result. This you have to keep in mind, guys. So the first point which you need to ensure that you go to a good hair transplant clinic which is doing hair transplant surgery quite frequently. So experienced doctor will be able to manage his team properly. He'll be dividing the work properly of technicians and the staff. So whenever the grafts are extracted from behind, immediately they should be segregated and kept in the fridge. So a lot of doctors who are experienced can manage the team very well. So you should inquire about the qualification of the doctor and the team who will be doing the surgery to ensure the good result. If the graft is outside too long, it is over dried and then kept in the fridge, the survival rate of graft is kind of less. If a doctor is not experienced or a technician is not experienced, there will be over extraction of your donor area. Whatever grafts you need to fulfill your bald area, only that many grafts should be extracted. And a good doctor and an experienced doctor will be able to point out that this many graft you need in this area. So the experience and the qualification of doctor and technician matters a lot. In almost all of the cases, 100% of the surgery I have not seen the plastic surgeon or the hair transplant surgeon is doing. Most of the part technicians are doing, and only the complicated part the surgeon is handling. So experienced transplant surgeon can manage the team properly and will be hiring only experienced and qualified technicians and staff. That is why experience of the transplant surgeon or the clinic or the reputation of the clinic matters a lot. So point number two, doctor and technician. So a reputed doctor and a reputed clinic will be having their separate OT, and you can say that personal operation theater. They will not be hiring or renting an operation theater and technician and staff just to perform one surgery. A lot of surgeons are experienced, but they are not exactly hair transplant surgeons. So they take operation theater on rent and the staff will be assembled just for your surgery. So in that case, that additional cost will be on you. So that surgeon might be saying that I'm experienced, I have staff, but he'll be renting it out, and that rent will not be coming out of his pocket. He'll be charging you for that. So just to go to a particular transplant surgeon, don't compromise with the city. In Delhi and Mumbai, a lot of clinics have their personal operation theater and permanent staff, and they do hair transplant surgery, 1 or 2 hair transplant surgery every month. So, and there are few very experienced hair transplant surgeons who are plastic surgeon also, and who are busy in doing other surgeries round the year, and they do 1 to 2 hair transplant surgery in a year. So always go for that clinic which is having personalized OT and permanent staff, because they will be coordinating very well among themselves. They'll be working very professionally and they know how everybody works. So the work will be done in a smooth and proper way. If the doctor is going to a rented OT and rented staff, the coordination and the output will not be that great. And don't compromise with the city just for saving few bucks. This is a hair transplant surgery, this is a cosmetic surgery, it's a surgeon art on your body. So better go for a clinic which is situated in Delhi or Mumbai, or a very reputed clinic even though in a small city but performing transplant surgery, 2 or 3 transplant surgery every month. So the staff is experienced, the staff is well coordinated, the staff is very experienced, the surgeon is doing only hair transplant surgery and specialized in that. So choose that clinic. Don't, just for saving few bucks, don't compromise with a local clinic with non-regular staff. So always choose a clinic which provides you end-to-end services. So just say when you go for hair transplant, first your head will be shaved. Make sure the clinic is providing you end-to-end services. It's not like that the surgeon is saying, okay, make sure your head is fully shaved off, then come to clinic. Make sure you have done this test and send me the report and then come to clinic. So make sure the clinic or the transplant surgeon you are choosing provides you end-to-end services, from head shave to transplant to bandage to blood testing and everything. In some cases they do not have a pathology, but they have good contacts that the sample will be collected in the clinic itself, hair transplant clinic itself. So make sure the clinic provides you end-to-end services. That's a very important part. So in my case, I will say that few things were missing. I got my surgery done from a plastic surgeon who is having more than 15 years of experience, personal OT, permanent staff, but still few services were missing. Like he was saying, make sure that your head is fully shaved and then come to clinic. So whatever the barber knew, he did the shaving of the head, but it was not proper as per the expectation of the plastic surgeon. Then in the OT itself, I mean, those technicians were trying to trim the head. It's not messy, and the clinic was not that clean, I would say. So when your cost is quite good, I mean, you have everything, then at least provide end-to-end services. From start to end, everything the OT should have facility to get it done. Grafts, distribution and sorting. So whenever your graft is pulled out of your donor area, some are multi-hair grafts and some are single hair follicles. So single hair follicles will be transplanted in your frontal hairline and temporal corners. So whenever the transplant or the surgery is in progress and the extraction is going on, there will be a separate technician sorting the grafts and keeping it in the fridge. So if the technician is experienced, he'll be sorting it very quickly and keeping it in the fridge. The grafts will not be getting dried, and the grafts will be distributed in that way that certain quantity or certain number of graft will be kept separate, that it will be used in the frontal part. Certain quantity or number of grafts will be kept separate in a separate plate, that it will be done in the middle portion to increase the density, and certain number of grafts will be kept separately, that it will be used in the crown area. When this way the surgery is done, it is ensured that whatever the pre-plan was to distribute and transplant the grafts is not missed. In my case, the biggest blunder that happened is they started surgery from here, the distribution is messed up, the technician was forgetting to keep the grafts in fridge from point to point, and everybody was reminding, please keep the graft in fridge, have you forgotten everything? So that was a complete mess up, and in the end, when there was a crown area transplant going on, there was a shortage of graft. I mean, my biggest area of concern just for the sake of hair transplant were crown area and this hairline. And I would say here only 40% is the result is there, and here the grafts were not there at all to transplant. Then what the hell doctor will do then? If there are no grafts to transplant, what they are supposed to do next? They cannot do nothing. So make sure the distribution and the sorting of the graft is done properly and in a timely manner. When the grafts has been pulled out, they should be sorted immediately and kept in fridge. Make sure you mention this to doctor. The graft should be distributed in that way that nothing is getting short. If more grafts are required, okay, please tell me beforehand and extract more grafts. But I don't want to hear the scenario that okay, there was a graft shortage, we'll do free of cost surgery next time. Who wants to get punched in head thousands of times just for the sake of okay, you messed up something? Nobody wants to do that. Proper diagnosis. So before transplant surgery, everyone who is supposed to or who is planning to get a hair transplant surgery has to go through a certain diagnosis. That is your blood pressure, your blood testing, and your ECG, heart rate. So in case there is some problem with the blood, the doctor will suggest you how to encounter that and how to tackle that. So in case you consume alcohol and cigarette or smoke regularly, you have to stop that at least 1 month before the hair transplant surgery, else the bleeding will be too much. You will be losing more blood as compared to a normal person just because you smoke and drink regularly. So that should be properly communicated to the doctor so that he can take proper decision. Heart rate. If you have a high blood pressure or a abnormal heart rate, that also should be diagnosed before the hair transplant surgery so that the doctor can tackle it. So one important point I want to mention regarding the proper diagnosis is the blood pressure. Make sure your blood pressure is in check and the local anesthesia transplant surgeon using is effective. In my case, my blood pressure was not diagnosed properly and it was a bit higher during the surgery. So and another bad part was local anesthesia. The local anesthesia was not working very properly. So during full 9-hour surgery, I mean this is a big mess up. I was able to feel every hole, every extraction, every transplant. That was a nightmare. So the anesthesia was not working very good, blood pressure was not diagnosed and was on a bit higher range. And when the trauma was happening, obviously the body will react. If the body is experiencing some trauma, if the anesthesia is not working and the body reacted, the body became hot and the blood pressure got shot up. That's a complication. That's why you need a good hair transplant surgeon. The bleeding was happening, what you can say, profusely. In simple English I can say the bleeding was happening too much. The bleeding was happening in such a way that the grafts were falling out because of the bleeding. Make sure that doesn't happen in your case. The blood pressure should be checked before hair transplant surgery. The anesthesia should be working. Make sure you discuss this with your doctor. This is a complication. That's why you need an MD doctor during your transplant surgery to handle these types of complications. And these types of complications can hamper your transplant result. Make sure this doesn't happen in your case, else you will be in trouble, big trouble. I'm telling you with personal experience. Nature of doctor and technicians. So the doctor should be very well balanced, very cool temper, very balanced, very professional, and very well behaved doctor. You must communicate with the doctor at least 2 to 3 times in order to ensure and judge his behavior. Whatever is gonna happen will happen, so you cannot control certain things, but whatever you can control from your side, you should put effort in that. So communicate with your doctor, ensure that he is of good behavior, very cool temper, and very well behaved with you and your family members if they are visiting with you for the surgery. Also the technicians also should be of cool temper, because in case the technician doesn't like you or he is temperamental or something, whenever he is extracting the grafts, he'll cut the roots. Then you have only grafts that is dead without any root. Even though he transplant the grafts, it is not gonna grow. So make sure that the doctor is taking care of the technician, monitoring the transplant surgery every minute in order to ensure the technicians are doing the right work. In my case, the doctor was not present in the clinic. I don't want to criticize somebody, but the supervision of the surgery was not that well managed as compared what I was expecting from a 15 years of plastic surgeon. So make sure that doesn't happen in your case. Doctor and the technician should be well behaved towards you and your family members. So one of my friend got hair transplant, and during the whole surgery, the surgery lasts for at least 6 to 9 hours. So during that surgery, one of the technician was constantly laughing, and that was a big distraction. So make sure that whatever happened with my friend doesn't happen with you. The technician should be professional enough. They should be concentrated towards the work. Normal chit chat is fine, but making somebody's fun and laughing during the surgery is a big distraction. So make sure your hair transplant surgeon is properly supervising the surgery and the technicians are in check. So in one of the cases of my friend who got transplant recently, that the doctor was hot-tempered doctor. So during the surgery, when my friend was asking questions, I mean, it's a cosmetic surgery, it's a surgery to improve your look, and the doctor started screaming, "Oh, you don't need to teach me anything, you're gonna train me today only, I also know something." So the doctor should be kind of cool temper. There are multiple ways to handle a questioning patient, but hot tempered doctor should not be the one doing your surgery. That's the most important point. A patient can be handled in a different way, but handling the patient who is already getting injured and hurt with the extraction and transplant and screaming on that person should not happen in any case. That happened with my friend. That's very unfortunate. That kind of unprofessional on the part of transplant surgeon, but that should not happen. Make sure this doesn't happen in your case. So this point I missed during my friend's surgery, that once the surgery was completed, the doctor was, I mean, already the patient is very hurt and in a very weak state, and the doctor started screaming that, okay, leave this guy alone, he is a grown adult, and screaming on his family members also. This should not happen. This is not very professional of that doctor. So already your patient has paid you something, whatever you asked, he has paid you, and after the transplant, 9-10 hours transplant surgery, you are screaming on him and his family members for what? Telling them that the patient is a grown up. Obviously he is a grown up. After 18 years only a person, I mean, after 20-25 years only the person starts shedding hair. Only after that he'll be undergoing the transplant surgery. You don't need to remind those guys. So make sure your transplant surgeon is very well behaved, very cool temperament. Every complicated situation can be handled through a good dialogue. Screaming or making some derogatory statements should not be the approach in any case. So I hope you like all the points. I have put a summarized table in the next slide of the video, which you can take a screenshot and pause the video or watch it online and keep watching it in order to remind the discussion points with your surgeon during inquiry about the hair transplant surgery. I hope you like the video. In case you have more questions, please put down in the comment section, and thanks for watching. So I got few comments, when you know all this, how come you couldn't get 100% transplant surgery result? I mean, my parameter was a decade plus experienced transplant surgeon, personalized OT, permanent staff, and my donor area is still very good, and I was thinking that I'm going to get a very good transplant result, and my doctor ensured me that okay, 95% of the grafts gonna survive, and you will be wondering after the hair transplant, oh, my look has transformed. That's why I got my surgery done. But it's okay, it's a cosmetic surgery, nobody can guarantee anything, and my 3-4 parameters which you can see on the screen were getting fulfilled. That's why I got transplant surgery from there. I was in touch with Prabhat Newani and Endtoend clinic to get the transplant surgery done. Because of the COVID situation, I didn't wanted to travel, and I was traveling from abroad, so I was quarantined, so there were some complications and risks, health risk involved, and during this pandemic time, and I was traveling overseas, I didn't wanted to take any health risk, and the clinic which I chose was fulfilling these requirements. That's why I chose that clinic, and I'm working to improve my results, and let's see what happens. I'll keep you posted.